Good afternoon, everyone. My name's Dr. McQuillan from Berkshire Menopause Clinic, and I'm going to be showing you how to use your topical estrogen on your urogenital area. I've been very careful not to call it vaginal estrogen because what I'm trying to show you is that it doesn't just affect the vagina, it can affect the bladder, the pathway to the bladder, it can affect your vulva, it can affect your perineum and your anus as well. And that is why it's really important we're not just applying it to the vagina. So let's go. So I'm using a demo cream here, and of course you will have your estrogen, topical estrogen that you've been prescribed. So the first thing I would say is be really generous. Take lots and lots of it. You can see I've got a really good amount here. And what I'm going to do is I'm going to apply it everywhere. So I'm going to start at the clitoris. I'm going to then put it all over both my external and internal vulva area. You may get an applicator as well, and so therefore you might find when you're getting to putting it into the vagina, you may wish to use your applicator. Or if you're comfortable and you feel happy, you're able to just put your finger in and go far in, as much as you can go. Okay, now you can see I have really lathered it on. Now, why have I done that? Firstly, we want to make sure we cover all of the area. If we're going to do it, let's do it properly. The other thing, as I said, this is your urethra, this is the tract which leads to your bladder. This is why some women get lots of urine infections, lots of bladder irritation. So what we want is we want it to really be absorbed. There are estrogen receptors in the bladder. There are estrogen receptors in the urethra. We want to make sure we cover our clitoris because we can get lots of changes in the clitoris. We can get enlarging clitoris, resorbed clitoris, which means your clitoris almost disappears. And then obviously our vulva as well, both our internal, we've got an external vulva and our internal vulva. And we want to make sure that we are getting to them because we have lots and lots of symptoms. Some women get it around the perineum, which is between the bottom and the vagina. And then obviously around the anus, you can also get a lot of itching and genitourinary syndrome of the menopause, we call it, which traditionally you might have heard of as vaginal atrophy. So this is making sure that we cover everything. You want to be doing this every day for 2 weeks, and then you want to be going to 2 to 5 times a week. That's right, I said up to 5 times a week. Traditionally, even if you're using the pessary, these used to be 25 micrograms and the maximum was 50 micrograms. We now have pessaries that are 10 micrograms. So the equivalent to that will be up to 5 times a week, not twice a week. So you may find that absolutely you are finding relief of using it only 2 times a week as maintenance. But if you don't, you can go up to 5 times a week. My tip is don't let anyone take this away from you. You can use this lifelong. We know that topical estrogen is minimally absorbed. We even use it in patients who we may not recommend systemic HRT. And so you can use it lifelong, and often women find that actually their symptoms come back if they don't use it. As well as using a good estrogen, I also advise use moisturizer. Moisturizers are great at replenishing tissue. So they are different to lubricants. Lubricants are a quick fix during intercourse to try and help with the lubrication, whereas moisturizers permanently replenish tissue. The same as our moisturizer on our face, we wouldn't let our face get cracked and dry. The same with our genital region, I advise the same. I hope that was helpful today.